Safe, yes.
Okay. Entering the scene, it looks like I have one male patient sitting in a chair, clutching his chest. He appears conscious and alert. What's my general impression from the room?
You just see him clutching his chest. Looks like he's got a little sweaty on his forehead.
Okay.
That's
All
what
right.
you got.
Good. Notify dispatch that I'm with patient and go ahead and enter. Make patient contact. Hey, sir. My name is Brian. I'm with the fire department. What's going on today?
Oh man, my chest is just killing me. It's just
Okay.
killing me.
So right now I'm feeling for a radial pulse. What do I have for a radial pulse?
Radio pulse is 110.
Okay. And is strong or weak?
Strong.
And I'm feeling for a temperature on his forehead here. And how does his forehead feel?
Temperature feels a little bit on the moist side, but not like exceptionally warm.
Okay. What was your name?
Mark.
Mark. So you're having some chest pain today.
Yeah.
Where is that located?
It's kind of in my left chest, like up top here.
Have you ever had that kind of pain before?
I've had it a couple times, but
Okay.
I just kind of been scared.
How long ago did this start?
It's been about 15 minutes.
15 minutes. And what were you doing when this began?
I just took the dog out for a walk like I do every morning.
Okay. Did you go on an exceptionally difficult walk or just your normal?
No, just normal.
Okay. When you said you've had this pain before, have you been diagnosed with anything?
No, I didn't want to go to the doctor.
So you've never seen a doctor when you've had this pain before?
No.
Okay. Do you have any medical history at all?
I think I have high blood pressure.
Okay.
Yeah.
All right. So at this point in time, I've established a little bit of rapport with my patient. My patient's name is Mark. He has a patent airway. He has good circulation. I felt his radial pulse. He seems to be breathing at a normal rate. At this time, I'm going to hold off on calling this patient sick just till I ask a few more questions. And as far as oxygen goes, he seems to be breathing at an adequate rate and depth, so I'm going to hold off on oxygen as well. My partner has taken vital signs for me, and as soon as he's done, I'll have him switch and take a bilateral blood pressure on Mark's other arm. Mark, how old are you again?
46.
Do you take any medications?
No.
No medications?
No.
Healthy 46-year-old?
Yeah.
Okay. Any family medical history of heart problems?
Yeah, my grandfather died of a heart attack about 4 years ago.
Okay, your grandfather died of a heart attack 4 years ago. Sorry to hear that. My partner's just checking your oxygen, checking your blood pressure. Would you like to go to the hospital today?
And I don't think this is normal.
Okay.
Probably should go.
Okay.
Yeah.
All right. So at this point in time, my patient has described to me kind of all the classic symptoms and signs of a potential cardiac event or ACS. So I'm going to go ahead and upgrade this call to ALS based on his skin signs and his chief complaint of chest pain with no history. Once we get a full set of vital signs, I'll further evaluate that,
So Brian,
as well as the need for oxygen.
Brian, I got vitals for you.
Okay.
Blood pressure is 140/92. Heart rate is 80. Breathing 24 a minute. SAT's 98%.
So blood pressure 180/110.
Okay.
Heart rate is 110 as I described before. Respiratory rate is as you find it.
Okay.
Still has that sweating on his skin.
Okay. As far as treatments go, for ACS, I can give this patient aspirin. His blood pressure is just within the normal ranges of not above 180 systolic or above 110 diastolic. Mark, are you allergic to aspirin?
No.
Have you taken any aspirin today?
Not today, no.
And have you had any bloody stools or anything like that, abdominal pain that would suggest that you have any internal bleeding?
No.
Okay. So we're going to go ahead and give him 4 baby aspirin, 81 milligrams for a total of 324. Why don't you go ahead and put your hand out here and chew those, okay? Chew them, don't swallow.
Okay.
You said that your chest pain was up here.
Mhm.
Is it radiating down an arm at all?
My left shoulder does feel kind of tight.
Okay. Any pain in your jaw?
Yeah, maybe.
And what about in your back?
Not my back.
Okay. Do you mind if I take a look at your chest?
No, go ahead.
All right, so I lift up my patient's shirt, visualizing that area. I don't see any bruising, redness, or deformities in his chest. If I push here, does that hurt?
No.
No? Can you take a deep breath for me? I'm pushing on your ribcage. Any pain? Does that increase or change your pain at all?
No, it's still the same.
Okay. Positionally, if you lay down or stand up, does that change your pain?
No, it's all the same.
And if I was to kind of try to replicate this pain for you, what would I have to do? Maybe stab you or squeeze?
I don't know, if you were to stand on my chest, maybe?
Stand on your chest? Okay. You mind if I take lung sounds real quick? And how was the blood pressure on the other arm?
I got 132/86.
Is that what I got?
Same as you find.
Or equal blood pressures on both sides? Okay. I'm going to lift up your shirt here in the back, Mark. You just listen to your lung sounds. Take a deep breath for me. And again. One more time. sounds are clear and equal bilateral. So Mark, just to recap, you've got pain in your left chest, side of your chest, kind of going into your shoulder, a little bit into your jaw. Never had this kind of pain before. It started 15 minutes ago or 20 minutes ago now as you were walking your dog. Came home, sat down. Never had this pain before. You don't take any medications. We've given you aspirin, and we have some other folks that are going to come out and put some leads on your chest, take a quick electronic picture of what's going on with your heart, and then we'll figure out a plan to get you to the hospital today, okay?
Okay, that sounds great.
All right.
Brian, I heard everything you said. I concur with your plan.
Okay.
Cardiac work.
Hey, medic 5 on scene. Hey, Brian.
Hey,
What's up?
this is Mark. Mark's about 20 minutes ago started experiencing some left-sided chest pain radiating into his left shoulder and his jaw. Started while he was walking his dog. States that it was a normal walk, nothing extra intense today. He's never had this kind of chest pain before. No medical history, no medications. Mark, no allergies, correct?
No.
Okay. And we gave him 4 baby aspirin. He is a little bit sweaty. His vital signs are he's slightly tachycardic and hypertensive, but not above the ranges for aspirin.
Okay.
So just at 180, 110. Lung sounds are clear, and his blood pressures are equal bilateral.
Okay. All right, let's go ahead and end the scenario. There we go.
Awesome.